So if you're just kind of, oh, just doing this, you're gonna miss if there's fluid tracking in here, okay? So what you need to do is start up mid-thigh, slide all the way down to patella, then see if you've got fluid in these little recesses here, okay? Now sometimes it's gonna be obvious and you can see a huge knee, but sometimes it's very subtle and you wanna make sure you're not missing any fluid that's sitting up in this suprapatellar recess there. So that's what I'll do to see if we've got an effusion. Other things are, you've lost these little contours here. They can't fully flex or extend their knee. And so that's how I'll do that, just really good inspection there, okay? So then I like to be on the same side of the table there, but I'll do it on this side and then the other side. So go ahead and lay back. So when you're doing Lachman, you are not trying to do this, okay? That's not how you're doing a Lachman. One hand is your stabilizing. So this left hand, stabilizing hand, this right hand, I like to tuck it right to my side there. So I'm not trying to do this way. I'm just holding this one and then, and can you feel that? Mm-hmm. And I'm just pulling up, that's all the move is, okay? So let me see if I can show on this side as well. So stabilizing with my right hand here. And that's it, I can feel a click every time. So it's not more complicated than that. There are people that argue, does not matter how big your hands are, you can do a Lachman no matter what the size. Sometimes if you're like, well, I can't get a good grip, I like to put their leg like this and then just stabilize and pull up like that. So that's what I'll do for Lachman. Give them a sit on their foot, pull forward for anterior drawer, push back for posterior drawer. I would say most times what happens with anterior drawer is if they have a PCL injury, they go forward, but you've already done a Lachman, you think it's okay, but then when you push them all the way back, you're like, that's way too much movement. So usually don't, for me, I usually pick the ACL up on the Lachman and the PCL up on the anterior posterior drawer. And again, those two things will have fusion, so we'll go over that. Another test is just looking at the movement of the kneecap, okay? So a lot of times people are hypermobile and you're just gonna wanna push their kneecap out to see how far it'll go. Usually people who had a patella dislocation, they're gonna be able to tell you, my kneecap moved. So you wanna ask, because sometimes like, I feel like I got hurt doing this. Did you feel your kneecap move? And they'll be able to tell you, yes, I felt it move for the most part. And so the apprehension test is not trying to dislocate it again. It is pushing it out to the side, and if they say, stop, don't do that, that's a positive apprehension. So that you have to have the apprehension part of it, okay? So what you will not dislocate their kneecap while their knee is in complete extension, okay? So it's okay to try to push it out like that. I mean, you're gonna scare them, but then you know that's what happened, okay? Sometimes you can feel to see if they have a little tenderness over the medial patellofemoral ligament there. That will help corroborate, but that's also gonna have a knee effusion. So for MCL, what I like to do is bring the leg up, push like that. LCL, bring them off the table a little bit and push in like that, okay? And you wanna make sure you tell them, so bringing them up, MCL, valgus, LCL, varus. You wanna tell them, hey, I'm gonna push on the outside of your leg, but I wanna know if it hurts on the inside. Because some people just say, yes, that hurts for everything, so you wanna just make sure that you're accurate with where you're asking. If you also wanna check, so putting someone in figure 4, the best way to look at that IT band, find the patella tendon, then there's gonna be a soft spot, then the next thing, that right there, that's your IT band, then there's another soft spot, and then that third thing there is your LCL. So it goes patella, tendon, empty space, that's your joint line, IT band, another empty space, and then your LCL, and it's best done in this figure 4 positioning. So those are the most things. Then for McMurray's test, you have to think about what you're actually doing. So, you know, don't just get up there and, okay, yeah, no, positive, does that hurt? Think about that. You've got your femur here, your tibia here, and you're trying to compress the meniscus tissue, okay? So what you're trying to do is take that tibia, roll it along the femur, and roll along that meniscus tissue. So that's what I'm trying to do there, okay? Now, I kind of cheated a little bit, and I just kind of, you know, do that to see if I can get it. You know, the correct one is, you know, doing it in internal rotation, doing it in external rotation. So you can do that, but I think if you just get your thumb at that joint line, roll it along, you'll be able to feel that. Usually that works pretty well. You can palpate if you think, okay, that is MCL, and see, okay, is that the spot over the MCL? Same thing with the LCL, just giving some pressure there. But for the most part, that's my typical every time knee exam.
Yeah, put a varus or valgus force into that ever, or you?
You know, I guess I kind of do when I'm doing it, but I'm not thinking about it. But I'm more just literally just trying to roll it across there. Like, yeah, I don't do it as much, no, when I'm feeling it there, but what other questions? Yeah.
You ever find just by palpating that they're like, yeah.
Yes, exactly. And there's sometimes where you just bend them up and they're like, yeah, that's the spot that it hurts so much, and to me that's positive. Now you can just, in your note, just say joint line tenderness rather than a positive McMurray's if your McMurray's is not positive. What I'll say is I have been tricked on the IT band runs right across that joint line, so there's many times where they're having pain over that lateral joint line, but it's more the IT band and not the meniscus. But when we learn up there, you know that if they have an effusion, you know it can't be the IT band. It's got to be the meniscus.